Good morning, ladies and gentlemen. Welcome to PPI Hall University of Merdeka Malang. In order to presenting about classical music as an effective therapeutic tool in optimizing language skills in autistic children. I want to say thank you all very much for coming today, and I hope you all can follow until the end. Okay, let me introduce myself first. Hello, my name is Alvin Andrean Syahputra. I am a psychology and English program student from University of Merdeka Malang, where today I'm responsible as a presenter in this presentation. In today's presentation, I'd like to give you some information and education about classical music as an effective therapeutic tool in optimizing language skills in autistic children. Okay, in today's presentation, I'd like to cover 4 points. Firstly, I will talk about understanding and meaning about autism and its causes. And then I'll explain about language skills in children with autism. After that, I'll move to the concept of music therapy with its function and purposes. And then I will take up about proving the effectiveness of classical music toward language skills in autistic children. So if you have any question that you'd like to ask, don't be hesitant to ask me. But beforehand, please keep them until the end because we have special time for question at the end. And of course, I'll do my best to answer them. Okay, let's get started. I'd like to start with looking at autism understanding and its causes. Okay, autism comes from Greek, namely autos, which means self that is helpless. According to J.P. Chaplin's Complete Dictionary of Psychology in 2001, there are 3 definitions of autism. The first is a way of thinking that is controlled by personal needs or oneself. Secondly, is response reward based on one's own visions and expectation and rejects reality. And the last is extreme preoccupation with own thoughts and fantasies. Okay, the cause of autism actually is not known for certain, but there are several predisposing factors. Um, there are genetic factors, hormonal factors, prenatal disorders, imperfect birth processes, and certain diseases suffered by the mother during pregnancy or childbirth so that cause disturbances in the development of the central nervous system, which results in impaired brain function. Kenner considers psychogenic influencer to be a cause of autism, such as emotional, rigid, and obsessive parents who raise their children in an atmosphere that is emotionally less warm, even cold. Another opinion says that the trauma to the child is caused by unconscious hostility of her mother, of his mother, indeed, but surely does want this child. This results in withdrawal symptoms in children with autism. Okay, so that's an overview of autism understanding. Now let's move on to language skills in children with autism. According to Monks in 1999, that language is a communication tool that has a social function. Deficits are sometimes we call weaknesses. It's obvious deviations in language development are one of the main criteria for diagnosing autism children. Children with autism are not only reluctant to speak and not only don't have the motivation to speak, but more than that. It's said by Kaplan in 1997. Some children with autism so language barriers such as mutinous, parroting like echolalia or babbling, speaking with meaningless syllables, and speaking by pulling hands. It states by voice of renewal in 2003, and this is confirmed, by most researchers who find that half of children with autism are not able to use their language skills. By Ruther in 1978 and 1994 in Barlow 2002. Next, we're gonna talk about, yes, uh, autism characteristic. Yes, children with autism have characteristic in interacting, among others, stated by Wing in 1976 and Davis 1999. There are stated that number first is less able to imitate the surrounding environment. The secondly is failure to use words in sentences, and the third is reverse use of words. Okay, I think that's just about language skills in children with autism. Next, moving on to the next section, the concept of music therapy with its function and purposes. Okay, the first one is music therapy concept. Um, the use of music as therapy has actually existed since ancient times. However, the development of music therapy in America only began in the 18th century. Evidence of the efficacy of music in healing can be seen from scriptures and historical writings from the Arabs, Chinese, Indians, Greeks, and Romans. It's stated by Johann in 2005. Anyway, National Association for Music Therapy in 1960, in the United States, uh, say that music therapy is the scientific application of the art of music by a therapist who use music as a means to achieve certain therapist goals through behavior change. Then next to the Wickham statement in 2000, uh, yes, in 2000, defines that music therapy as the use of music in clinical, educational, and social settings for clients or patients who need treatment, education, or intervention in social and psychological aspects. Actually, the role of music in music therapy is certainly not like a drug, but it can immediately relieve pain. Music also doesn't immediately overcome the source of the disease. Okay, next moving on to the function of music therapy. For the first is a music therapy function in terms of expression functions. Giving music therapy to extraordinary children aims to stimulate the will to express and channel their feelings more freely. Music can be a medium for someone to channel their emotions, social and psychological, so that tensions that may exist can be lost or reduced so that a safe and relaxed atmosphere arises. The function of expression in music therapy is intended to make it more obvious that there is a spark is what is hidden in a person. The secondly is in terms of communication functions. Art is essentially a medium of communication. either directly or indirectly between human beings, human and their gods, art serves as a means of communicating the delivery of things contained within a person to the intended object. Likewise, in extraordinary children, they have a sense of art to communicate. Music therapy is given so that a person can make music as a medium for channeling his emotions, social and psychological, to be able to communicate with the surrounding community. The third is in terms of creative functions. Every individual, both normal and abnormal, has creative power, but the quality and degree are different. With music therapy, it is hoped that after individuals see or listen to other individuals singing and playing musical instruments, they will imitate and try to play or sing a song. Based on this, each individual will be able to bring out his creative power and desire to do something actively so that encourages them to tend to be creative. Okay, the next one is in terms of adaptation functions. With the music therapy officers, teachers, coaches, and parents can adapt to other guidelines that serve as support for rehabilitation services at school and of course at home. Okay, let's move on to the next slide. Yes, goals of the music therapy. Number one is improving children's concentration power. In general, the concentration of extraordinary children is very low, especially autistic children in receiving lessons. So the teacher or therapist is required to demonstrate interesting movements and then choose a comfortable rhythm so that it will stimulate the child's concentration so that they can be involved in the learning process. The second one is returning closer individuals to reality. And by participating in music therapy activities, children will be moved by their soul and open their feelings of individuals who were previously closed in the to the outside world. Okay, we've looked at the concept of music therapy with its function and purposes. So next, I'd like to take a look at proving the effectiveness of classical music toward language skills in autistic children indeed. Okay, the first one is stated by Sumarmo and Jenadrana in 2002. They say that music therapy serves to stimulate communication and one's expression. The next is from GRE Consulting in 1997, which states that music can develop a person's emotional function. The next is Johan in 2005 that one of the advantages of music therapy is that it can condition the nonverbal expression of thoughts and feelings which are usually difficult to express verbally. Next is Melissa in 2003 that also states that in music therapy, it is possible to identify music as an option to communicate using nonverbal language, both with oneself and with others. Some research results show that 80 till 90% of people with autism respond positively to music as a motivator. It says by Johan in 2005. Each individual, include child and adult, affected by autism is an individual with a personal uniqueness and a combination of behaviors that make them different from normal individuals. And then music was able to influence the cognitive development of children as well as make children smart to socialize. In 1998, Don Campbell, a musician and educator, together with Alfred Tomatis, a psychologist, conducted a study to see the positive effects of several types of music. The results are stated in their book, which was published in Indonesia under the title Mozart Effect. Harnessing the power of music to sharpen the mind, increase creativity, and nourish the body. And then, according to Lewis, a psychologist as well as a music therapist from the prison education program in RSAB Harapan Kita in Jakarta, uh, she said that Mozart's music is not the only thing that can be used. All the music with calm rhythms and soft playing has a good effect on fetuses, infants, and children with special needs. Because it is often called the Mozart effect of compositions of music, it was Mozart who was the first to be studied. Music therapy is a stimulation to the balance of cognitive and intelligence aspects, and um, it turns out the music can affect children's cognitive development as well as make children smart to socialize. Okay, and then Lewis, in her research, proves that the music provides many benefits to autistic children, such as stimulating the mind, improving concentration and memory, and then improving cognitive um, aspects, and then building emotional intelligence and etc. Music can also balance the function of the right brain and left brain, which means balancing the development of intellectual and emotional aspects. Children who receive music therapy are expected to become uh, people who think logically, as well as intelligent, creative, and able to make decisions and have attention. Let's move on to the next slide. According to J.C. Seattle in his book, Developing Mind Toward Neurobiology of Interpersonal Experience, classical music produces calming alpha waves that can stimulate the limbic system of brain tissue. And then music can provide stimulation to cognitive aspects, as stated by Campbell in 2001 in his book, The Mozart Effects, says that Baroque music such as Bach, Handel, and Vivaldi can create an atmosphere that stimulates the mind in learning. And then about classical music, such as Haydn and Mozart, can improve memory, concentration, and spatial perception. Next, it's Gallagher's statement in 1998. He said that this ability was further optimized through stimulation by playing classical music. The rhythm, the melody, and then harmony of classical music can be a stimulus to improve children's learning abilities. Through classical music, children easily grasp the relationships between time, distance, and sequence, which are skills needed for proficiency. Okay, next. The results of Harry challenges in 1996 and Seychelles in 1999 research, which is best that neurons will become circuits if there are musical stimuli, and then stimuli in the form of movement, chaos, sound, cause separate neurons to link and integrate self in brain circuits. The more musical stimuli are given, the more complex the relationships between the neurons will be. That is actually the basis of cognitive abilities. Next is music succeeds in stimulating patterns and being a bridge for more complex jokes. Also supported by Martin Gardiner in 1996, in Goleman in 1995, from the results of his research that art and music can make children smarter. Music can help the brain focus on other things being studied. So there is a logical relationships between music and cognition. Uh, for example, in mathematics, because they both involve ascending and descending scales, namely bits in music and numbers in math. Campbell in 2001, in his book The Mozart Effect, the process of listening to music is a form of effective communication and provides of emotional experience. Emotion is a subjective experience that exists in every human being. To be able to feel in and appreciate and evaluate the meaning of interaction with the environment, it can be stimulate and optimize development through music from an early age. From some of the definition above, it can be seen that music therapy is not only correcting and overcoming a deficiency, but can also be used as a means of prevention. Okay, I think that's bring us to the end of my presentation. I'd like to finish by concluding from what we have learned before. It can be concluded that the language skills of people with autism with verbal abilities develop when given music therapy. In other words, classical music therapy can optimize language skills in children with autism. Okay, I'd like to say thank you all for coming today and for sure putting your attention and interest in this socialization or in this presentation. So mm, I think it's over. Does anyone have any question? I will be happy to answer your question for now. Okay, no one? Okay, it's totally great. It shows that you will understand about what I say. Once again, Ted, I want to say thank you for coming today and putting your attention and interest into the presentation. I hope you can implement from today's material. Thank you and thank you and see you next time. Bye.